Hey everyone, it's Dr. Rick. Today we're going to talk about physical therapy and rehabilitation. Today I'm with Lori Hill. She's a physical therapist that works with Advocate Sherman Hospital. Hey Lori, how are you?
Hi, good, thank you.
So if you could introduce yourself to my patients and let them know what you do with Advocate.
My name is Lori Hill. I'm a physical therapist. I've been a physical therapist for approximately 30 years and been with Advocate for approximately 25 of those 30 years.
Excellent. And you are the closest physical therapy center to my office in Bartlett.
Correct.
The one thing I love about your place for physical therapy is that you have a gym upstairs.
Correct.
A lot of physical therapy centers have equipment, and usually I would expect upon graduation with my patients that you guys fix whatever is deficient, whatever is ailing them, and then maybe graduate them onto some other lifestyle change or some endeavor that's sustainable. Do you take them upstairs at any point in time?
My hope is I can progress patients from the standard hands-on physical therapy to upstairs to our gym, and then within the last 1 or 2 weeks of their therapy session, I try to get them on a very consistent fitness exercise program they can do on their own.
Very nice. That is outstanding. I think that's a step above an average physical therapy center. So Advocate has several physical therapy centers.
Actually, there's an outpatient clinic in the hospital itself. There's one on Royal Boulevard. There's one in the Immediate Care Center in South Elgin. There's one in the Immediate Care Center in Algonquin. We have one in Huntley, and myself.
Oh, that's right. Huntley just opened
Huntley,
up.
correct.
So we have a wide range of places that you will be able to get to. So Lori, for the sake of the patients that haven't been through physical therapy before, could you walk them through, because I know what happens after I hand my patients the referral and they leave my office. What happens after that?
What they're going to do is they're going to call the central scheduling phone number for Advocate Sherman Hospital. They'll get a hold of one of our registrars for the Advocate Sherman Physical Rehab Department, and they have access to my computer and to my schedule. And basically, they just will tell the person that they're talking to they want to schedule therapy in Streamwood. They will pull up my schedule, and they will find out from the patient what is convenient for them, day and schedule time. And they'll go ahead and schedule the first initial evaluation and the follow-up 2 visits.
Does that mean when my patients get to see you the first time around, they're going to be doing the rehab immediately?
We try, if at all possible, we try the initial session to do, in addition to the examination and evaluation, I try to, if I have the time, if time allows, I try to do the first treatment session as well.
Got it. As a lot of you with fibromyalgia might know, and I have fibromyalgia, it is a little bit daunting when you go to a physical therapist, because if the objective is to cool down the area that's a trigger point, this is my trigger point, sometimes the exercises will actually flare up. So for those of you who are apprehensive, could you explain what you usually do for the ones that are really flare up as far as back pain, trigger points, or
If somebody's having a hot flare-up or an acute flare-up of the fibromyalgia, we primarily try to deal with getting those symptoms down, to calm things down. So we'll do the initial very gentle stretching program, primarily the modalities to help with the pain, the massage, the heat, the ultrasound. Once we get them with their pain levels a little bit more tolerable, we focus on the exercises, primarily focusing on a home exercise program and having them change or get used to having a regular fitness program, because a lot of them are not used to doing that.
Right, and it takes a little bit of endurance. It takes time to build up endurance, takes time to get past pain. Sometimes I talk about modalities to my patients. I explained to a couple of you about what modalities are, like ultrasound and electric stimulation.
Mm-hmm.
Does everybody usually require modalities? Or?
Depends on what we find on initial evaluation. It depends on what their functional limitations are, depends on what their perceived pain is. Primarily only do modalities for those people who are in the higher level of pain and the decreased functional level. Those people who are functioning a little bit higher, I'll try to start them immediately with the exercises.
For those of you who do flare up, what's the usual, if they flare up, and most people will, hopefully not too severe, I'm hoping I would have given you a little bit of a Band-Aid just in case when you first start out, either an anti-inflammatory, a muscle relaxer, or a rescue pain pill. Or the other way, if we've talked about it, is usually herbals. Spray on magnesium, turmeric, sometimes valerian with hops to soothe or cool down spasm. In the event that they do spasm up or get worse, what are they supposed to do at that point?
I tell patients if after they have their physical therapy session that it is quite common after the initial evaluation they may be a little bit more sore because their body's not used to doing the movement and the exercise, which is why we give them very limited exercise to begin with. It's to their tolerance, and the key is pacing. They have to learn to pace themselves. They have to realize it's going to hurt some, and they have to learn that they might have to push themselves a little bit, but if they get to a certain point, there's a level, we tell them do not go past this level. If they're having a flare up to that point, back off.
Okay.
And then we reevaluate at their next therapy session. I review the home exercise program, try to find out if there's any one that's may have been the trigger that made it a little bit worse, and we will just then try to reassess and maybe start things all over.
Lori, some of my patients actually don't have any problems when they come in to see me, but they're looking for lifestyle change. Like now it's January, I have a lot of folks that are still gung-ho with their resolutions, and sometimes they'll wonder, or you guys will question, why do I need physical therapy? Well, here's the thing. If I find through your questions and answers that you have a history of a pinched nerve, history of an ACL that's deficient, that's a knee ligament that's deficient, or if my evaluation, your scapula, your shoulder blade is popping or snapping, you go and hire a personal trainer or join a gym with a membership that's locked in for a year, I would rather have you go through prehabilitation. And could you explain to the folks what prehabilitation is?
Anybody who walks into our office, the very first thing I would do with an evaluation is what we call a physical therapy screening. At the time of the screening is when I go through a whole body system. We go through the primary tool for that is the history, the patient history. And majority of these patients who are coming in from Dr. Rick are people who might not have been active for long periods of time because of underlying comorbidities or underlying disease processes. And so quite often they're going to have people who are going to have, knee stiffness or shoulder stiffness or a weakness we're going to find in some of the muscles. And so it's key that before they want to start any fitness program to prevent any possibility of injury, I can do a screening and see if I find any limitations. They might have limitation in mobility, they might have limitation in strength, and if they went ahead and just started working out on their own, they could set themselves up for further injury if they do not have the part all rehabilitated correctly.
So Lori, once somebody graduates from physical therapy, you'll probably send them back to me, I'm
Correct.
sure. How often should somebody come back and see you, or should they even come back and see you?
It depends on what the diagnosis is. If somebody has MS or somebody has chronic RA or somebody who's a fibromyalgia patient, sometimes those patients will have flare-ups. If they have flare-ups, then we recommend that they go back to see you at any time and they can get a referral and we can start the whole process over again. Those people who have a more chronic type of issue, such as a chronic low back problem or things like that, our goal is for them not to have to see me. Our goal is for self-maintenance, for them to be able to get on with their life and continue with a regular fitness program and not to have to be seeing therapy. But we are understanding that there might be times in their life where they might have a flare-up of that as well. They might have lifted something wrong, they might have slept in the wrong position, and again, we would just start the process with starting with the doctor, and then I would go ahead and start doing the screening and the evaluation, and we could start over.
That is an excellent point. Even with my patients, once you get into the office and we develop that team approach to have the coaches in the field take care of you and empower you even further with lifestyle change, the idea really is for me to minimize your medicines to whatever's necessary and then have you maintain your healthy lifestyle on your own outside my office, and maybe you won't even need to see me. I think that's one of the rewards with healthy lifestyle, is that if I can construct something different with the interaction you have with me, if Lori can see what might have worked before, what didn't work before, your strengths and your weaknesses, and empower you to go further, then you should be able to sustain a healthy lifestyle on your own. Lori, some of my patients have a heavy deductible, and with the new administration, insurance is going to change again. So I know my deductible with Advocate is $3,000. And for those folks who just can't afford that, or for those folks who don't have insurance, which will probably change soon, how do I get them to navigate around that obstacle?
There might be a couple options. I do know that the hospital does offer, through a patient who has to do self-pay, if you contact the business office, there are some arrangements on, that they may be able to work out with them. In a case like that, most likely, the key would be for me to get them started as soon as possible with a home exercise program, and not to have to see me more than probably for the evaluation and maybe one more follow-up visit. And then the key would be I would be sending them on some further tools they could use via the internet, such as accessing the American Physical Therapy Association website, the Mayo Clinic website. There are a plethora of things that they can find on the web. Do have to be careful, but if it is sponsored by a recognized organization such as the APTA or a licensed physical therapist, then you can find plenty of exercises that they can do on their own.
Yeah, there are great websites for information, but there are also dangerous websites for information. So I would expect you to always portal me through the Advocate portal about things you might be interested in, and I might be able to help you. But Lori gives a good point. And finances are tough. And it might seem that you can't afford to get in, even for one visit. But you heard Lori, we can sometimes work around that or design a personal program for you. That does not mean the rehab process will be as short as anybody going in 3 times a week. But again, we can formulate it around the limitations. So the warning is that I know a lot of you might have experience, whether it's running, high school sports, college sports, or some other endeavor that you went through before that you were successful with. But you have to be careful. The one constant is that we always get older. And as we get older, things and mechanics change a bit. So if you're on your way to a healthy lifestyle and sustainable lifestyle, what my objective is to make it injury-free. If I can foresee an injury coming, or if Lori sees that there's mechanics that are off, it would be worth the investment in having an expert watch and evaluate possible deficiencies that would set you up for failure, or worse, injury. When you get injured, I'll always be there for you and we can work around that, but then you lose the momentum, you lose the steam, and I want transition into healthy lifestyle to be very smooth. The one thing I like about Advocate is that there's always communication between departments, and I believe that when you have efficiency of communication, then you guys get better faster with sustainable change. Just in case somebody might down the road have a problem, do they have to contact me through the phone, or do they have options to?
They're welcome to contact me. They're welcome to do it either via phone or by email. That is probably the easiest way to get a hold of me, because if I am hands-on with the patient, I'm not always able to access the phone. It would be to contact me via email, so I can get back to them on my own time.
And the Advocate Portal is how you know to get a hold of me, whether it's choosing a vitamin, having a cold or cough, or deciding on a different plan that we talked about. But hopefully the Advocate Portal will be open to the physical therapists as well. Until that point in time, you have Lori's email.
Correct.
So this is Dr. Rick. Don't forget, if you liked what we talked to you about, then give me a big thumbs up. Otherwise, subscribe to me for weekly words of wisdom. Thank you, Lori. That was great.
You're welcome.